Welcome to episode 242, Affirming Bisexual and Pansexual Clients, Clinical Tools for Inclusivity, featuring Dr. Lana Holmes, licensed clinical psychologist. Make sure to subscribe to be alerted about future episodes by Clearly Clinical. Learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am really excited and honored to have this conversation with Dr. Lana Holmes. She is joining us from Georgia, and one of her specializations is working with all considerations really relating to queerness. And the conversation in particular we're going to be having today is about bisexuality and pansexuality. And I am just delighted to have Dr. Lana on today. Thank you so much for joining us.
Thank you. It's a pleasure, Beth.
So for our listeners who are not familiar with you or your work, why don't you take a moment and tell us about your background and then how this came to be one of the topics that you really specialize in?
Yes. And so I'm a licensed clinical psychologist based in the state of Georgia. And I guess the reason why I particularly focus on queerness and issues related to LGBTQIA2S plus folks is personal. And I guess it's also part of an ethos. So I identify personally as a Black, bisexual, cisgender woman. And from an early age, I knew being a part of these particular groups is going to be met with discrimination and hatred. And so for me, it was very personal about figuring out, well, what can I do to help other people like me? And I think that just naturally kind of fit in with my work because a lot of my work centers around being there for people that are from marginalized, oppressed, and stigmatized communities. So that also includes BIPOC people. That also includes people of like the kink, BDSM, and leather communities, but also people who represent a broad range of religious and spiritual traditions, including those that sometimes go under the radar or that people feel aren't mainstream. So for me, it's just about making sure that there are places of healing for folks that often don't feel like they have anybody to support them.
Thank you for that and for being one of the people doing that work. The topic of bisexuality and pansexuality, I mean, there's so much here. And I just want to say before we start talking, there's obviously only so much that you and I can cover in an hour. And just as Dr. Lana has shared, I am not straight, for lack of a better term. And the challenges and considerations sometimes for people who are bisexual and pan really don't get discussed very much. And we'll talk today about some of that visibility.
Mm-hmm.
But thank you for joining me in this space in something that is just a reality of our considerations for our world. So thank you, Dr. Lana.
Oh, no, I'm absolutely happy to do it. Somebody's got to do it, right?
Yes, someone's got to do it. Absolutely. So as we dive into this topic, why don't we start with just the very simple definitions? What does it mean to be bisexual, and how is that similar or different to pansexuality?
Yeah, so I think the simplest definition for bisexuality is being attracted to more than one gender, hence the bi. But the difference from pansexuality in that pansexual individuals will say that they are attracted to people of all genders. And so, sometimes the way that people have described it is like it's the opposite of like monosexuality, so only being attracted to like one gender in particular, whether it's heterosexual people being attracted to, cis people of the opposite gender, or, individuals who identify as homosexual who are going to be attracted to someone of the same gender. So those would be probably like the best ways of trying to conceptualize it.
When we're thinking about bi and pansexuality, at least in Western culture, the word pansexuality wasn't used very much before 20 years ago.
Mm-hmm.
Can you speak to that a little bit, kind of in the Western evolution of integration for a spectrum of sexual preference?
It's interesting because I think most of it is based on social movements, right? So if we think about people, so it's kind of coincided. If we look at first like the kind of gay rights and gay liberation movement, the mid 20th century, how that eventually cascaded and evolved into other members of the queer community saying like, hey, we're not being properly represented or included either. And so really it started from the ground up with people who are, transgender, non-binary, etc., who are just basically gender diverse, who are just saying like, hey, we're not being properly represented within our own community. We are being erased or rendered invisible. And so we want to speak up to affirm our existence, but also to affirm our humanity and our rights. And with that, as we became more aware of like the full spectrum of gender, that also trickled into research, that also trickled into community activism, and also into legislation. So, I mean, with any of these changes, when we look at a marginalized, oppressed, or stigmatized group being better known or better understood, it's more about people from this community speaking up. And I use the word aware because sometimes, and I'm sure you as well as our listeners have heard this sometimes, so people are like, everybody's turning gay, or everybody's becoming trans all of a sudden, or everybody's turning, and it's like everything that you can think of when it comes to the full spectrum of human sexuality has existed since we have been a species. There's nothing new. It's more of the attention and the language that has been adopted to describe different people's sexual orientations and gender identities. And I think that it can take a longer time if you live in a society that is biased towards or that puts a priority on certain identities over others. So if we look at Western industrialized countries and cultures, there typically has been more of a bias towards heterosexual, cisgendered identities and orientations. And if that is seen as the default standard of human sexuality, desire, attraction, then a lot of people are going to be left on the margins and ignored. And so then those people have to take it upon themselves to step up and say, we do exist. We're not evil or amoral or, pathological. And so yeah, that's the way that I see it. It's more of like this ongoing struggle from people from the ground up to go like, hey, we do exist and let's provide like clarification and understanding, but also people frankly fighting against this heteropatriarchy to be able to go like, oh, this isn't the only representation of what human sexuality is or can mean or what gender identity is and can mean.
I think that cultural element is really important to consider. And being that we're in Western culture, handed these values, learning that other cultures don't necessarily see it this way, and that these differences in our sexual preference, in our sexuality, may be celebrated in different cultures, but in certain cultures, denied, erased, shamed, what have you. Within the queer umbrella, bisexuality and pansexuality tend to face a lot of erasure. Can you speak more to that, and kind of the origins of the gay rights movement in the United States, and how the the rest of the queer community really fit into that at the time, because there was so much visibility and so much conversation around a gay, particularly white male identity, and extraordinary hardship and discrimination for that community, and then all these people kind of on the outskirts.
There are a couple of different pieces to that. So when we speak about like bi-erasure or pan-erasure, that it kind of is like, to me, and like it is connected to both biphobia and panphobia. So what happens is that people who identify as bisexual and pansexual, they basically face double discrimination. So they're not only facing discrimination from people in the heterosexual community, but also from lesbian folks and gay folks. And so what this can typically look like is people making invalidating statements or microaggressions where it's like, well, you're confused. You don't really like, or that's not a valid sexual orientation, or, you need to just pick one group of people that you're going to be attracted to in relationship with, and you just need to go with that. And so it's a lot of like outside invalidation, and that can create this sense of isolation, but it can also be an impetus for people to stand up for themselves. So that's one thing. But also, when we speak about erasure, is if you are bi or if you are pan, people's sense of your identity can kind of wax and wane depending on who you're dating. So if you are, for example, a cisgender person who is heterosexual, you don't even really have to think about like explaining or justifying your sexual orientation. But then a lot of people will just look at your coupling and be like, oh, you're straight. End of story. Similarly, if you're someone who is out and you are lesbian or gay, and people see you with your partner who's also the same gender, it's like, oh, well, you are lesbian or gay, that's it. But one of the things is if you're bi, so let's say, for example, we have a cisgender bisexual man who is currently in a relationship with a cisgender gay man, is that people look and be like, you're both gay. And it's like, well, wait, that's actually not true. And so what the other erasure is that people can just make assumptions of what your sexual orientation is based on the gender of your partner, rather than actually taking the extra steps to be like, well, how do you identify truly? Which can also lead to having to repeatedly come out. So instead of just having like a one and done where everybody knows for time, infinitum, that like, oh, I am, bi or I am pan. Bi and pan people usually have to repeatedly remind people, like, actually, like, regardless of the gender of my partner, this is my identity still. It's like a constant. It doesn't just go away. Because the other piece of that too is people will be like, oh, so, you're straight now, or you are, otherwise queer now. And, so that's another form of erasure. And I think, when it comes to the gay liberation movement, like what you were saying, is particularly thinking about the 1960s and 1970s, is that the kind of, it's tricky because, like, and when I think about events like Stonewall, there were people of color that were also queer that were intimately involved in that. Like, when I think about, Sylvia Rivera, who was a Latina trans woman, or when I think about Marsha P. Johnson, who was a Black trans woman, of like, they were intimately involved. And in fact, there's this audio of Sylvia Rivera speaking at a gay liberation event about like the importance of affirming trans women and trans people in general, and being booed by cisgender gay folks, and her having to read the riot act to them and saying, like, I have risked my life, I've nearly died for gay liberation, and you can't even come for me and my folks, you can't even support us. And so there's always been this tension, and I think sometimes it's hard for me to describe, because I think at a default level it makes sense that if you all are within this kind of unified, well, if you're in this community, that even though there are differences, as there are differences within the LGBTQIS2S plus community, because it's a umbrella, right? But we all are bound by the fact that we are queer, that we do not fit within this homogeny of being cisgender or of being heterosexual, that there would be persistent, cross-cutting love, support, and compassion for each other. And yet there isn't. And I mean, my positionality in theory is that I believe that we're all affected by systems of oppression, whether it be cis heteropatriarchy, white supremacy, classism, etc. And I think that what systems of oppression teach us is that look at whoever is more vulnerable or strange or vilified than you are at the moment, and crush them to make yourself feel better. And I don't think it's necessarily conscious always, but I think that that is what's taught us. So I've seen that kind of dynamic play out, where we're reenacting the trauma of repression on each other in, marginalized, oppressed, and stigmatized communities. And so I think that in response to that, the marginalized among the marginalized usually have to rise up and correct people and go like, well, wait a minute, this isn't right either. That, like, if we're truly trying to defeat this sense of hatred and bigotry against all people who are not straight, against all people who are not cisgendered, then it's important for us to correct and recognize the tendency to vilify each other.
You brought up so many great points there. And going back to what you had said about erasure and invisibility, I think your example about Stonewall is such a good one because there's kind of this cultural construct in our minds of who was there and who was involved. And it's not accurate. And so I'm glad that you brought up that point because, as you said, the spectrum has always been there. It's always existed in humanity. And then we take this little kind of subsect of society and say, oh, these were the people who were involved, or these were the people that were affected or invested, when in fact, it's kind of this whole umbrella. And to the point that you just made about the in group marginalization, we can see examples of this in colorism. We can see this in different communities. And I'd love for you to dive into that a little bit more about marginalization for bi and pan folks within the queer community and understanding that element of it. Because I think for people who are on the outside of the community, I've certainly had the conversations where it's never even been considered. But that idea of the routine coming out, because if, whatever assumption somebody is making, they've classified you and said, okay, you fit into this column because the gender of the hand that you're holding, then therefore this is you and I will hold you in this column. And that is not necessarily accurate for bi and pan folks.
No. So, like, when it comes to in-group marginalization, it's just this odd and tricky phenomena. Because when I think about it, like, the first thing that comes to mind is just like real life anecdotes, experiences of people that I've experienced and that other people experienced. It's hard to tap down the origins of why, except with these like greater social and cultural factors. So I always put the blame on like cis heteropatriarchy, because if we go back to something like colorism, for example, for BIPOC folks, colorism wasn't something that BIPOC folks invented on their own. It was due to the systems that were set up as a result of white supremacy, which basically said that the closer approximations that you have to whiteness, then the more privileges, the more rights that you can have. And if you can pass, so passing as in if you have light enough skin tone that you could appear to be white, then that will be kind of a loophole for you to kind of escape or reduce some of the indignities of racism. And that's not something that people of color invented on their own. It was something that was put, and I would dare say it's kind of a survival mechanism that was put, particularly in the days of Jim Crow, but even before that, going back to the days of colonization, and then also the transatlantic domestic slave trades, where it's like, well, maybe this is one way that I could somehow survive this brutal, unrelenting system that doesn't seem to have any signs of stopping. But it's also painful, right? Because you're denying who you are, and you're denying your culture, and you're denying your community. I mean, there are stories of people who literally just live their lives as white people, cut off their family, cut off their friends, so that they could escape, quote unquote, racism. Now, when we look at the queer community and why there can be that like in-group discrimination, some of it has to do with transphobia too, because I think like if we look at individuals who are pansexual, it I think is hard to extricate any kind of discrimination against trans and non-binary people from also having a certain level of discrimination against pansexual folks.
Yeah.
Because I think basically the underlying premise that may be unspoken is that you don't value the lives of transgender people. You don't see transgender people as being valid in their gender identities. So I think that's one thing. Also, I think sometimes, because I just try to think about the arguments that people have made, and it's never made sense to me, of things like, oh, you're being greedy, or I think sometimes people have described it as like, well, you can hide, right? Like, I can't hide my identity as a gay person or as a lesbian person, but like, if you got a partner of a certain gender and your relationship was straight appearing, you could choose to pass and you could choose to kind of circumvent, um, you know, the hatred and the vitriol directed towards the queer community. But again, that's an assumption, because I think that, as the research bears out, like, bisexual and pansexual people aren't necessarily having a great time. So if we look at like all the members of the LGBTQIA2S plus community, when it comes to mental health outcomes compared to heterosexual folks, everybody has worse mental health outcomes. However, bisexual and pansexual people have a higher risk and higher rates of depression and anxiety compared to both gay and lesbian folks, but also to straight folks. And I think it is, when we look at it, it is due to that discrimination that really is illogical.
You've mentioned that phenomenon specifically of bi and pan invisibility. And what's interesting is when you look at the research, more people identify as bi or pan than do as explicitly gay or lesbian, which is kind of confusing to think about because we think of, like, again, the visibility. If we think about visibility and the conversations we're having, what words are used over time, what I think in the United States, when we think about like queerness, as you've already said, it's kind of like gay or lesbian, like cis, trans, and then like leaving out the other stuff. And it's really interesting that the other stuff, depending on which study you look at, either exceeds or meets about the same as the more common columns within the marginalized communities, if that makes sense.
Yeah, no, absolutely.
I would love for you to speak a little bit more about the realities. You've mentioned a little bit about kind of the assumptions that people are making for bi and pan folk, but like, how is the coming out process different? You said, more frequent, I guess, in some ways, depending on the assumptions made about you, but also like, I'm thinking about children and teens that may be having these attractions and like they've never even considered this possibility because it's like, well, you're this or you're that. Pick a team.
Mm-hmm.
And then what about both teams? And like, how does that fit into the experience for bi and pan people and understanding their own sexual identity, whether or not they choose to ever become public about that?
Well, I think when we look at the research of like how people are able to identify themselves as being queer in general, but bi and pan in particular, as well as being able to make the decision whether or not to come out, part of it has to do with information. So being able to have access to information where they're able to accurately identify what the attractions and desires that they're experiencing mean. But then also being able to have representation, and being able to know what resources or kind of social supports they can tap into to better understand themselves. Because it's one thing to just learn about data about like, this is what it means to be this particular sexual orientation, but it's another thing to be able to have other people that you could look up to, that you can ask questions about, and who could kind of be like mentors and friends essentially, um, for you. So I think one of the things that can help people to understand, like, oh, there is another option instead of just lesbian or gay, is being able to have access to accurate information that explains, like, this is everyone under the rainbow, right? So that's one piece. But then when it comes about, if I remember you asking correctly, the decision to come out.
Yes, and is it different for people who are bi and pan? Knowing that we're talking in generalizations right now, and obviously everybody's decision is individual.
Yeah. So in some ways, it's very similar to individuals who are lesbian and gay, and in some ways, it's different. So we do know that there can be a struggle for bi and pan people when it comes to making a decision whether or not to come out, for a lot of the same reasons that gay and lesbian people do. So fears of being rejected, fears of being ostracized, fears of being subjected to various forms of assault or violence. Also, particularly a concern for young people is whether or not they're going to be disowned, kicked out on the street, etc. Also, even for adults, about employment protections, right? Because we still don't have uniform job level protections for queer folks. So there's some similarities or cross-cutting there. But then some differences is that if you are bi and pan, of usually being in the position of having to repeatedly come out depending on the gender of your partner. Because usually people will automatically make assumptions rather than asking. And so that is the main difference of being able to have to like repeatedly affirm your identity to people and correct them when they make assumptions. But another aspect of it is, the psychological and emotional impact. So when we look at people who are still concealing their identity as bi or pan, that they have worse mental health outcomes, which is what we know about staying in the closet in general. And so that's another consideration as well, is that when people feel like they can't be honest about themselves and they have these very real fears of there being really adverse or even threatening or dangerous reactions to them coming out. That's the reason why. And I guess another thing I want to make sure that I state with that is sometimes when people historically have looked at the data for queer people in general and bi and pan folks in particular about worse mental health outcomes, people have made this, erroneous correlation of like, oh, well, it's just the very fact that you have this sexual orientation as the reason why you have poor mental health. I mean, I've heard it from people myself in real life of like, oh, you are experiencing depression or anxiety because of this. And that's not it, because all the research that we have showed that there's nothing pathological about being bi or pan or queer in other ways. Also, that even though there's a very murky and shameful history within the field of mental health, and particularly the DSM, in previous editions of homosexuality being listed as a mental health diagnosis, that has been corrected and removed from the record. And also, it's been realized that there's never been any research basis or scientific basis to connect being queer with any kind of psychopathology. Um, but the issue is about the nature of discrimination, and a particularly helpful framework is the minority stress model, which basically talks about if you belong to a minority group, in this case, if you're bi or pan, then there is the stress that comes from having to navigate stereotypes, having to navigate prejudices, and having to navigate all the ways in which your ability to just freely move in the world and have the same rights as others are either curtailed or cut off. And so the stress comes from that. It comes from outside, but also it can be internalized, right? So the outer discrimination, bigotry, stereotypes can be internalized into people and result in internalized biphobia or internalized panphobia, where people, even if they do know that they're bisexual or do know that they're pansexual, that they suppress it because they feel that there's something wrong with it because of these outside messages. And people can struggle with a lot of shame. Also, as a result of it, people can struggle with a lot of self-hatred as a result of it. Or sometimes people will feel an ambivalence, right? Where they're like, I know this is who I am, but I am so afraid of what the consequences of living my true self will be in my life.
In our culture, as you and I record this in 2024, it has been somehow more acceptable for, I'm going to step solely into the binary, looking at this through a dominant culture lens, to put on our cherry chapstick and kiss a girl, and I liked it. It is more acceptable for women, for people who phenotypically are assumed to be women, to have sexual attraction or sexual contact with other women or people who are phenotypically assumed to be women than it is the alternative for men and people that are assumed to be male. How does that break down in the shame associated with bi and pan identity? Because on some level, you need not look far on a college campus to, kiss, 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 whatever, around two chicks, quote unquote. You know what I mean? Like, versus the profoundly different realities for the way we view masculinity.
Yeah. Ooh, this is about to get spicy. Um, it's just the reason why I say that is because, like, what immediately comes to mind is social conditioning, where two people who are either assigned female at birth or who identify as cisgender women engaging in any kind of sexual or affectionate contact has been presented and reinforced as being a form of entertainment for cisgender men. And it's not even like usually seen as like, well, these are two people who have the right to be who they are, right? And that it's really not for us, it's not for our viewing pleasure. But I think that there's been so much in our culture and society and media that has reinforced this idea of like, it's just entertainment and it's not even about you. It's about making sure that cisgender men are able to get pleasure or titillation from it. And I think if you have that kind of perspective and lens, then it's hard. And again, it goes back to cis heteropatriarchy, which has these very rigid binary gender norms and social scripts attached to that. Because I think one of the things that masculinity, or that cis heteropatriarchy teaches about masculinity, is that you have to be heterosexual. And that if you are not heterosexual, then somehow you are less of a man. And we know that there is nothing factual to support that premise. But, again, I have heard from bisexual men, from pansexual men, or from bi and pan folks who are identify as masculine or assigned male at birth, talking about the rejection that they can get from both cis men who are queer, but also from cis women. And some of the stereotypes that can come with it are not already what we've mentioned of like, oh, you're confused, but also it can get into things like I've heard, people be like, oh, well, somehow I think that you're more likely to give me an STI, and people being saying like somehow I think that you're this vector of disease, which is not true. But so it's a lot of these both like homophobic, biphobic, and panphobic things that kind of come into the equation. And again, it's always based on assumption.
Absolutely. Thank you for leaning into kind of a spicy question. As a therapist who has worked the majority of my mental health career within this community, having seen that real time, and unpacking all of this mass conditioning, um, speaking for myself, my private practice website has always been pretty clear about who I work with. And so it's like, interesting that you chose me. You know? And maybe we'll talk about that one day and maybe we won't, and that's just fine. But this these social contextual layers that impact what a bi or pan person may face in considering their own sexuality and then sharing that. These are different paradigms because of that sexualization and the entertainment factor and toxic masculinity and these ideas that that land differently within the bi and pan community. The other thing that I've seen and want to bring up in this conversation is I'm trying to think of the right word for it, infighting that can happen between bi and pan.
Oh, you're just dropping the heavy hitters here, Beth. Like
Sorry.
you're just like, no. But it is true because I think one of the things as more and more people have become aware of gender diversity, and then with that, more and more people realizing, hey, when it comes to sexual orientation, pansexuality is, a valid sexual orientation. There's sometimes been this infighting between bisexual folks and pansexual folks. So some examples I can think of, both personally and professionally, have been folks who've kind of been like, well, why do we even need like bisexuality, right? If you're saying that like you're attracted to more than one gender, then like why can't you just say that you're pansexual? Or some people even, going so far to make this either the supposition or to make accusations of like, Well, if you insist on being bisexual, then you are inherently transphobic because you're inherently excluding people, even though there are people who do identify as bisexual who are like, well, I am not excluding anybody. Like I could, date someone who is transgender or non binary, but it's my preference and it's something that feels more accurate to describe myself as bisexual, but it's also becoming more common for some people to use different terms. So like multiple terms simultaneously, where it's like, oh, I'm bisexual slash queer, or I'm bisexual slash pansexual slash queer, to try to represent like all the different areas of their sexual desire or romantic desire, and attractions. But this is the tricky thing because I think it is hard to pigeonhole people. I think people's decisions around how to identify are very, very personal. Um, I've heard some people straight up be like, I don't have the time or energy to like change, my like the way that I identify, like even if it's not 100% textbook accurate, like this is something that I feel at home in, and I don't want somebody to take that from me or to try to pressure or force me to change. Um, and there are other people who have made the considerations about how to adjust how they identify in order to make sure that they're essentially not hurting people or making people feel excluded. So, but I think it speaks to I don't know, of it's the importance of recognizing that when we're talking about bi people, pan people, or other people that belong to marginalized, suppressed, and stigmatized communities, to not purely focus on these people as if they're theoretical constructs, from this purely scientific, like, well, based on all this research or based on all of the kind of data that's been collected from movement work and history, this is how you should identify. But instead going like, well, we do have this wealth of knowledge, but also what does this mean to you when you say you're bisexual and pansexual? And being able to approach it from a non-judgmental perspective instead of basically coming in and either advertently or inadvertently trying to tell people this is how you should identify because you check all these boxes.
Thank you. Thank you for leaning in on a spicy question. And I know it's a really specific one, and it comes up. And in thinking about the validity of bisexuality and pansexuality, the potential expectation from the outside to prove it.
Mm.
I saw your eyes light up. Go.
Oh, oh, because this is personal. I mean, if I may tell a personal story, I can, I've known that I was bisexual since I was, maybe about like 5, 6, or 7 years old. Um, but I didn't fully come to terms with it until I was in my 20s. And it's not unusual because I think, even though there are some people who've known and who've been out for years and they've known since like the early stages of development, there are some people who it took some time, both in terms of accumulating information, but also being able to feel comfortable enough to be like, this is my identity and I'm going to share it with other people. But I can distinctly remember an experience in my 20s where I went on a date with a cisgender man and I was very upfront of like, I'm bisexual. And we were watching a movie and he said, well, which one of these women are you attracted to? And it felt like a test. It felt kind of like like if you're like the unspoken thing was like, if you're really bisexual, then like you're automatically going to be attracted to like any woman and man that you're presenting. And mostly he was focused on the women. It wasn't like, okay, like, are you also attracted to this dude over here too that's in the same scene? And it's like, and it's something, the reason I highlight that is because I've also heard it from other people who are bi and also from other people who are pan, of folks who will be like, well, if you really, really are this, then you need to demonstrate that you have this like mathematically even dating history. That if I were to randomly present you with a pool of people from all the different genders that you are attracted to, that like it's going to have like a fairly even breakdown. And that's not how it works because, as a comparison, if you were to ask a straight person or a person who's lesbian or gay, like, hey, let me just randomly throw out names of people who have the same gender, like, are you attracted to all of them? Most people will be like, that's ridiculous. And yet people will do it so easily for bisexual and pansexual people, of the sense of that. And I think one of the things that we've talked about when we talk about like combating bi invisibility, bi erasure, but also pan invisibility and pan erasure, is recognizing that even if you have never dated someone of the particular genders that you find yourself romantically or sexually attracted to, that you still are valid. Because I think sometimes people, that's one of the tussles that they can have internally over whether or not they are pan or bi, is folks will be like, well, I've never had the experience, right? Like I've never dated. People may be like, I've had crushes for years, or I've, just always just automatically found people of certain genders attractive, but I've never acted on it. And it's like, well, yes, that is valid. Like you don't have to have like this litany of people that you've dated or had sex with in order to count.
Thank you. Thank you for sharing, and thank you for going into that. I think now we're having more conversation about sexuality outside of homosexual, heterosexual, two columns, and also seeing examples of people that are coming out, celebrities, athletes, that I think are changing the conversation, and that context matters, to read about and see examples of people who I look up to, whose music I listen to, whose movies I enjoy, whose stand up I love, and go, oh, that's really powerful. And back to what you had said about, yeah, there's some people that are going to have recognized this at 5, 6, 7 years old, and then sometimes not. But it all goes back to kind of this validity slicing. Well, if you're bi or pan, then you must have known it in childhood. For many folks, it never even occurred to us as a possibility. We never said anything to anybody about it and went, I think everybody, nobody, I don't know. Okay. And carried on. And there are some really beautiful books out there. Looking at my bookcase, like Women Who Love Women, Married Women Who Love Women, in this evolution of our own sexual identity and stepping outside of pick a team and stay a team.
No, and I think, one of the things, because there are similarities across different groups of people who experience marginalization and who are minoritized. And this is the idea of representation, which when you think about it, is very similar to like social psychology principles around modeling, right? Of it's really, if you basically are a part of a group where there's a lot of stigma attached, or where people give you the messaging or the indication that like, oh, folks from your group don't really succeed, folks of your group are abhorrent, folks of your group are bad, then it's really, really important to be able to see other people who are like you, who are living their lives and who are succeeding in whatever area or subject matter that they're doing. But also it just lets you know, like, oh, there are other people like me. So it can reduce that sense of isolation. And I think public figures coming out definitely has been helpful. Also, social media, I think, has changed the game a lot. Because think about it, of like before, in, for example, the ye old 90s, shall we say, for those of us of a certain age, is if you were pan or bi and you lived in a smaller community, or maybe you lived in a city, state, province, or country that wasn't really queer affirming, it might be really hard to find community. It wasn't impossible, because even back then you can see in different stages of history, even in places that like periods of time, excuse me, that were virulently queerphobic, there were still people who found community and who found ways of protecting and supporting each other. So it's not as if it was non-existent. But I think in terms of having the sense of safety of like, oh, I clearly know that there are other people like me who are out and who I can connect to, I think sometimes it was harder. And I think social media has made it easier for people to not only find access to information and resources, but also to be able to be like, there are other people my age, from my racial and ethnic background, of my religious or spiritual affiliation, who are also pan and who are also bi, who I can just socialize with, form relationships with, who I can ask questions and share experiences with. And so I think that being able to have that representation, but also the advancements in technology have made it easier for people to connect and to be able to know that they're not alone. Because I think one of the things is if you, for example, have a family system or a local community where that isn't really present, it could be hard to find those connections. Also, when I think about media, particularly I'm thinking about examples from when I grew up and perhaps when you grew up, there wasn't really anything out there that was really affirming and very clear when it came to being bisexual or pansexual.
Well, I was just thinking about how if we look at examples in the media, these things were speculative. And we even see that in the stories that are being told biographically now, where they're these speculative stories of like, was he or wasn't he?
Mm.
But it wasn't actually named. And I think that that's a different thing from having it named and recognized and acknowledged instead of this kind of nebulous, again, two columns. You are or you aren't. And then it's like, but what if there's something outside of that? And then it's like, no. Like, and I see that in these stories when you dig into certain public figures to understand like who were they, and so much speculation born out of the lack of safety in a society where they could not have any, or were choosing not to have a sense of authenticity and outness for themselves.
Yeah, no. And I think also, especially if the public figure is someone who has died, it can be complicated because then you don't want to put yourself in the position where you're saying, I'm putting this label onto you. Um, Especially if it's like people don't feel comfortable, like, especially like surviving members of their family or friends, or like, well, we want to keep that personal for this person. Um, but also, if there's not enough information. But also, I mean, there are people who even again during like times that were very biphobic and panphobic that were out, like I think about Josephine Baker, for example. uh, but then there are also people like the late great David Bowie who, even though like it's interesting because he was also very humorous about describing himself. Like there's one interview where he said, I'm a trisexual, I'll try anything. But he's someone who dated cisgender women, cisgender men, but also transgender folks as well. So, you look at some people where even if they perhaps didn't have a precise label that they applied, or it would be difficult, where it's like, well, I know that you were similar to me, right? Like, I know that you definitely weren't straight, and I know that, like, you were someone who was able to succeed, who was able to do great things in the world while also simultaneously having relationships and having sex with people who were of different genders.
Switching gears into thinking about this clinically for the listening therapist, whether specialized in working with this community or not, for many, many queer folk, the first time we say the thing out loud is terrifying. I mean, even my heart is pounding just saying that. And I'm just naming and aware of that because there can be so much fear and such big feelings associated with it. How do we, as clinicians, work to create deliberately pan and bi inclusive environments?
There are a number of ways. So I think one thing is when it comes to any materials that you may have about your practice or whatever organization that you're part of, like making sure that you're very clear that you work with people in the LGBTQIA2S plus community. If you have particular areas of specialization, even within subsets of that community, also specifying that. If you have either a digital office or a in-person office, of making sure that materials, whether it be books or academic journals, posters, whatever, featuring people from pan and bi communities are on display, because that can be something that is just like quick cues that give people a sense of like, oh, I know that you are familiar and knowledgeable about working with people in my community. And so I know that this, will hopefully be, or at least has signs of being, a safe space. Also, if you come from the community, being open. And I know that disclosure as clinicians is something that we have to take heavy consideration in. And obviously, we want to make sure that it's in service and benefit of the client as opposed to for yourself. But I think the benefits, if you are bi or pan, to being out about that is, again, that modeling of like, it's normal. It's just as, nonchalant as saying that you have brown hair or something. But then also, I think a lot of people from stigmatized communities want to be able to work with someone who not only has book knowledge, but also has that personal knowledge. Because, there's that sense of, oh, well, I don't have to go into deep detail explaining all these different things to you. You already know what I mean when I talk about these kind of experiences. So that can be helpful. Obviously, it's not required, but at the same time, if you are a part of these communities, it can be helpful doing what we're doing now, of being able to take continuing education courses, other forms of training, reading books about it. But also, one thing when it comes to not only pan and bi people, but anyone else that's minoritized, I always emphasize really get to know people as people, because I think there's still going to be a gap of knowledge if a person has read all the books, attended all the workshops, but they do not know a single pan or bi person in their life, and they have not made any efforts to like connect with their local or regional pan and bi communities. Now, I'm not saying be forced. No, be like, don't necessarily go out there with a placard with like, will you be my friend, bi and pan person out there? But being able to just think about that, because one of the things I've considered as our field has evolved and really tried hard to provide affirming mental health care for various people that have been, pushed out or ignored in our field and in our treatment models and in our methodologies of care, is it's one thing to have that sense of like intellectual philosophical understanding of a person, but it's another thing to have that like direct knowledge of having relationships with people and really knowing people on a personal level. And so I would say really trying to think about how you could cultivate that as a clinician. Also, the American Psychological Association has guidelines for psychological practice with sexual minority persons that was published in 2021. That includes some of the things that we should be aware of, but kind of doing an overview is being able to understand the histories and definitions and context of what it means to be pansexual and bisexual, of making sure to affirm bi plus identities and recognize that they are not mental illnesses and that these people are not in need of being turned straight or being convinced to change their sexual orientation, because that would constitute conversion therapy, which is unethical and is going to do a bunch of egregious harm, as research has shown. We also want to understand the impact of stereotypes, bigotry, and minority stress when it comes to the mental health of people that are pan and bi. But we also want to highlight the positive experiences, because I think sometimes there can be so much emphasis on, oh, it's so hard. And which it is. Like, I never want to downplay the fact that there can be a distinct level of pain that comes from being marginalized. But there's also so much joy and fun and pleasure to be had. And, that bears out in the research that shows that some of the positive aspects, for example, for bi and pan folks, is being able to have a community, being able to have these wonderful, rich experiences when it comes to romantic and sexual partnerships, of being able to be one's full self. Because I think that's something that we kind of glaze over, of like, if you can really be your full self, that is going to do so much good for a person's mental health. If they know that they can just say who they are, date who they want to date, and be comfortable in that, and know that they have support for that, that is going to do tremendous good for people's mental health. So I think being able to highlight that in clinical work about like, yeah, let's like talk about all the things that you inherently enjoy about being pan and bi. But also, if, the stressors from discrimination come up, how can we navigate that? Um, and then, also being able to consider how other parts of a person's identity, but also other kind of variables intersect with being pan and bi, because there might be unique considerations that people have to make based on their family makeup, based on their geographical location, based on their culture of origin, their religious or spiritual affiliation if they have one. But also, it's interesting to look at how people's sense of their identity intersects with lifespan development, because someone who may have first come to terms with and understood being pansexual and bisexual at age 15, and their experiences during adolescence may evolve, right? And so being able to look at it from a lifespan development lens, where it's like, as you're getting older, like, what are these new things that you're discovering about this aspect of your identity?
Thank you. Every single item you just listed is like worthy of more conversation. Um, One of the other things I want to throw out there for our listeners, if you're thinking about this, just even in terms of your forms and paperwork and those signals of safety, I'll call them. We have a great episode featuring social worker Kyle Bullock talking about creating a more affirming practice. I really recommend like some great guidance in there, thinking about your intake forms. What boxes are we having people check off, and are there boxes at all? Are we just having a blank there that people can fill it in? Those considerations really matter. And to piggyback on something that you had said, this modeling of inclusivity, and I think for clinicians, for us to be really aware of our own biases and our own, I call it marinade, but our conditioning that influences how we see the person or people sitting in front of us and the language that we're using in the day to day. For example, oh, you're married. What does he do? Whoop, there was. Like, I just made a big assumption. And that kind of deconstruction of these assumptions that we make.
I would definitely agree with that. And I think that's something that can be done in consultation, but also I think in self-reflection. And I would encourage people that if they come across any biases, to not judge yourself. Because I think one of the things that can happen, all of us have biases. I do, you do. It's a part of just living in society. The way that I would compare it is like you're going, like, encountering pollutants. Like, it's hard not to encounter the pollutants of white supremacy or cis heteropatriarchy or classism or any of these kind of things. And I think what can be really scary for people is sometimes if they realize that they have a bias, is they worry like, oh, does this mean I'm a bad person? Or, oh, does this mean that, like, I'm going to be ridiculed or attacked? And I think it's important to know that, it's not about that. Like, it's impossible for any person to be bias free, but more being able to recognize it, correct it, take accountability for it, and see what you do to change it. That's what's more important.
Thank you. Thank you for making that note. You had brought it up earlier, and I want to jump back to it. The way that anybody publicly or privately wears, if you will, their sexual identity, and the coming out process. Have you found any interventions other than what we've already talked about that may be really helpful to lay the groundwork just to explore that? The possibility of one's sexual orientation, and are they bi, are they pan, and how, like, are there books, are there handouts, like what do you find really helpful to kind of welcome those conversations? And what I say with my clients is like the conversations in our hearts, the ones that maybe we're not having out with anybody, but the conversations in our hearts when it's just us, when our head's on the pillow, or when we're standing in the shower and staring off into space, like how we can help clients kind of work through that in their brains.
Yeah. So what's interesting, and you can join in and add your feedback or observations too, is there isn't necessarily, from what I've seen, like an evidence-based, queer-focused only kind of treatment model that's targeted towards the queer community overall, or bi and pan individuals in particular. But what I have seen and what I do utilize is a culturally competent approach. So basically, being able to just talk about the issues that pertain to being bi and pan, and being able to bring that up, but also their existing treatment models, whether it be CBT or psychodynamic therapy, where they have like certain skill sets, like Socratic questioning, for example, that can help people to kind of get into a flow of like self-inquiry and exploration, and also being able to even frame these like negative attacking thoughts about, that are related again to internalized panphobia and biphobia, and be able to recognize that those are essentially cognitive distortions, right? Because cognitive distortions at their heart are inaccurate thoughts that drive, you know, emotional and psychological distress. While also being able to use problem solving skills of being able to talk about, like, if people are like, well, part of the reason that I'm struggling is because I'm really, really afraid that, for example, if I come out, um, I will lose my friends, I will lose my family, or even if I don't lose them in the most, severe sense, I don't want to know that people are looking at me differently or treating me differently. And being able to talk about, like, well, what are some strategies we can come up with to kind of emotionally, address that, for example, but also what are some like alternative social supports, because I think, chosen family, which is a construct that's been present throughout the queer community for time immemorial, is a useful way to address that, where people, you can simultaneously like address the grief if loss or significant change has happened within existing relationships, but then being able to be like, are there other people who can fulfill those roles, right? Who can still be steadfast support for you, even if members of your family or, friends start treating you differently, or even if those relationships end.
Thank you. I think that you just gave some ideas for clinicians to really conceptualize creating that safe space, but also kind of breaking down the potential realities that may be happening here. The shame, the potential grief and loss. What does it mean for any of us at any point in time to relate to ourselves differently than we did before, and whatever feelings and conditioning we have around that concept. We've merely scratched the surface on what is obviously a really big topic. And I'm grateful to you, Dr. Lana, for coming on and talking about this, because I think you've introduced some ideas that not only expand kind of our clinical awareness, but also make us think too about a more embodied perspective of a spectrum of sexuality than what we may have been given by a dominant culture, by our immediate culture, by religion, by whatever else. And I think when we as clinicians can think deeply about these things, I think it is a service to our clients. For our listeners that want to learn more about what it means to be bi and pan, and or how we clinically can support clients who are exploring that and are bi and pan, what do you recommend?
Well, because I am a frustrated librarian at heart, I have resources prepared. So, if you're looking for peer-reviewed journal articles, I would recommend the Journal of Bisexuality, also Psychology of Sexual Orientation and Gender Diversity. Also, there are books like Bi, The Hidden Culture, History, and Science of Bisexuality. Also, Bisexual Men Exist, Bisexual and Pansexual Identities, Exploring and Challenging Invisibility and Invalidation. And that last book actually is a scholarly book from Routledge. And then when it comes to websites, there's bi.org, Bisexual Resource Center, and the BiPan Library. One thing I will say is there still isn't enough, in my personal opinion, resources that are dedicated exclusively to pansexual people. So that's one area of growth that I hope to see. But there still, is enough to, start to familiarize people.
Thank you so much. And for our listeners who want to learn more about you, again, Dr. Lana Holmes, what is the best way to do that?
So you could go to the website for the Center for Inclusive Therapy and Wellness, and that would be www.inclusivetherapywellness.com to learn more about me and the clinical work that I do. Also, I have a LinkedIn page that could be visited as well.
Thank you so much for joining us and for both your openness and for your expertise. I've really enjoyed having you today.
Thank you so much. It was a pleasure.
You've just finished listening to another exclusive continuing ed podcast by Clearly Clinical. If you like what you just heard and you need continuing ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of continuing ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.